and I could see you are doing very well. I am Dr. Bose, I am your treating pulmonologist. Mr. Ajay Rai Chaudhary, I want to ask you a couple of questions because what I could understand, you are recovering very fast from your disease. This is a video which we are recording so that patients who will be watching this video, they can be benefited. Because as a doctor, as a super specialty working in respiratory science, our job is twofold. First of all, to create awareness about the specialty, and secondly, to tell people so that the right practice parameters can help patients to recover faster. Now, I just want to quickly ask you a couple of questions. Mr. Ajay Rai Chaudhary, you are a very educated person. You are working in a banking sector. You are 58-year-old. You are well maintained. You are a healthy person. You have a wonderful family. What happened about 10-15 days back when you first came to me? What exactly? Can you tell me? What was your symptom like?
Symptom, at the initial stage, I had fever, coughing, and severe breathing trouble.
Okay. You said you had a severe breathing trouble. The kind of breathing trouble which you had about 2 weeks back, almost
Yes,
2 weeks
yes,
back,
yes.
it was very severe, I could understand.
Yes, it was severe.
And when you came to me 2 weeks back in my office, in my medical center office, I could see that you were not able to breathe enough. Your respiration was very fast. And I put a little, this meter, which is called oximeter, which you're now maintaining 99%. It was 74% if I remember when you
Yes,
came.
it has dropped to 74%. Despite nebulization and oxygenation,
It
I
was
could not
going
recover.
up. So imagine a situation where your oxygenation is 74%. 74% is an acute severe respiratory condition because 74% means your oxygenation is less than 20-30 millimeter in the body, which is a catastrophic condition. And you recall that despite being, our center is a very high-end center, we have all the support system. If I recall that you were given continuously oxygenation, but your oxygenation was not going up more than 80%,
Yes.
80-84%. You remember that day?
Exactly.
And as a doctor, since though I'm a specialist for you, but you're like a family physician, we know you for so many years and all, I try to treat you at home. I give you antibiotics, I give you inhalers, and I give you oxygenation. But did you do well with the treatment at home?
No, I could not recover at home.
You could not recover at home. And you said when you met me after 2 days after initial, session with me, I said that your oxygenation checking is very important. I still remember the day when I sent my worker to your place, and he prompted me that your oxygenation is still 84-85% on exertion, so which is quite alarming. Then what did I do? That time, if you remember, I said, okay, this is a pneumonia, and the X-ray showed it was an extensive pneumonia of both the lungs.
Through CT scan.
Through CT scan, because lungs, sometimes, X-ray doesn't pick up all those things. So remember, in clinical situation, when we have a severe drop in oxygenation, the conditions are only two. Either the lungs are flooded with water, or the lungs are flooded with pneumonia. So the audience should know, low oxygenation is a very dreadful situation. It can happen in acute severe asthma also. Like suddenly your asthma goes very bad, you can drop your oxygenation, or your lungs are flooded with bacterial pneumonia. This is an infection of the lungs, what you call the consolidation. Or if there is a sudden waterlogging in the heart, this can happen in a heart patients. So these are the three situations. Another last condition is that if you suddenly the leakage of the lung, what we call pneumothorax. So we saw your lung, there was no leak of the lung. Though you are an asthmatic, but mild to moderate asthmatic, but asthma was not an answer to explain that kind of drop in oxygenation. But I remember when I got your X-ray done, there was a patch in the lung, but it was not showing that big. But your oxygenation is one thing which was very scary. You remember?
Exactly.
So I immediately, when you came next visit to my office, then I told you, no, Mr. Ajay, you need a CT scan. And really that was a path changing. And it was an eye opener. I saw the CT, both the lungs were full of patches. And I said, no, I will not take chances. This is a community acquired severe fulminant pneumonia. Because any pneumonia, normally 80% pneumonia, they don't drop their oxygenation level. Because normally pneumonia we treat in the outpatient office, in the outpatient. But any pneumonia which causes a drop in oxygenation is catastrophic. And despite the fact that you were given enough oxygenation at home, despite the fact we were giving you a basic antibiotic, so I didn't take any chance. Do you think coming to the hospital, you're in one of my high dependency unit in hospital, the National Heart Institute, which is one of the primary tertiary hospital. Do you think by coming to the hospital has helped you?
Definitely.
How do you think it has helped you?
I could recover only after getting admitted in the hospital. Because
Why you think? Because there are two things which will help you. What if I remember that we were trying every possible root cause to find out the possible reason for this kind of pneumonia. The one thing, if you remember, that really helped us, we took your sputum in the time, and you helped us. And you think, I must congratulate you. You are a wonderful patient, a very educated, very humble person, and you cooperated all through. And the sputum which you gave me with a lot of effort, that really made the difference.
Exactly.
Because sputum showed the right organisms, and the organism which grew was Streptococcus pneumoniae. This is the commonest organism which causes pneumonia. But what is happening in the society? This same pneumonia which was there about 40 years back, the pneumonia is not changed. The organism and the behavior of the organism has changed. The organism has become much more virulent, violent. Because the people are using randomly antibiotics, people are primary physicians, they don't follow the protocols. So we found that this organism has become very, very virulent, and we could find the pattern of antibiotics. So sputum culture has helped us, and based on that we found that we are sensitive to clindamycin, vancomycin and linezolid. They are very special antibiotics. Immediately, though I was already covering you about levoflox, which shows partly a sensitive, maybe some initial effect was there, and the day I admitted you, the next day I got the antibiotic result. That helped me, because on the first day I decided I should send you a sputum. Don't you think that was really a difference which I brought in your treatment?
it made the difference. It made the difference, definitely.
Because I could start the right antibiotic on this. I put you a combination of clindamycin, vancomycin and the linezolid. And now you see, you were admitted in which day? You remember that? 7th February. 7th February he was here. His oxygenation was low. His oxygenation was, despite an oxygen, you were in 80% or 88%, I remember.
Yes.
But on 10th, 48 hours or 72 hours after starting the right antibiotics, your oxygenation started improving, you agree?
Yes. It reached to 95.
It reached to 95. And after 3 days, we discontinued on your oxygenation system. And now you could see that on air, you're breathing 100% oxygenation.
Exactly.
So that means the 100% oxygenation is basically the thing which made the difference, because that means the right antibiotic at the right time made the difference.
Exactly.
So it was not an asthma which has got aggravated. It is a pneumonia which has really got fulminant. It was a virulent pneumonia. It's a fulminant pneumonia. It's a very severe community fund, and this is what we call respiratory failure. So you came in respiratory failure, and the right antibiotic, the right strategy, the right intervention, and the oxygenation helped you.
Yes.
Now tell me, what are the things you have learned in the process? Like, you're an educated person and all of those things, and you have a family history of asthma. Do you think, what could be the reason for you to get this kind of pneumonia which is so picked up so violent? What are if you look back?
One of the main reason I could find out that I could not prevent myself from the severe cold I faced.
Yeah. So that means you want to say that.
And another thing, there's the dust which you should have taken protection from.
So you could see the dust factor, which is the Delhi is getting very dustier day by day. The smog effect.
The construction work is
the
going
construction
on
work
around
is
us.
going on. A lot of viruses around, because we are surrounded by bacteria. We have to protect ourselves, because you cannot change the environment around you. What you can see increased. So one thing probably we went wrong is that you continued with your cold, which you delayed, because you have an asthmatic tendency. The cold got, because your immune system went down, and you picked up a bad bacteria because of the activity which is going around your house, or maybe the environment where you're staying, and that picked you up. That really triggered the whole process. So you think if you would have come in time, probably things would have been different. But now, what is your message? You think that what is the message you have learned after recovering? Because we'll be sending you after a day or so, because we are basically, this is the 6th day we are giving you the antibiotics. Any antibiotic should be given for 7 days as a protocol. So I could see you're absolutely normal, and we are just waiting for the antibiotic dosage, because there's injectables which cannot be possible to give it at home. So what is the message you learned?
Message I learned that we must take precaution from at least dust, and proper prevention from severe cold.
And also, if you have an asthmatic tendency, you should adjust the dose when the season changes.
Definitely.
So right adjustment of the inhalers. And
I must admit that I was rather careless in handling that from that point.
So you have been careless in handling. You thought probably inhalers, okay, we'll take an SOS basis.
Exactly.
So now onwards, what you learned, that you should take care of the cough and cold. You should take your immunizations in time, because we'll be giving you. You should take your adjustive inhalers based on the weather factors. And more important, you should not, delay your symptom. You should not wait for the symptoms to worse. You should approach the doctor right in time.
Definitely.
So the couple of things I want to tell you is that this is a pneumonia, which is a fulminant pneumonia, which I told you, the audience which should know, because pneumonia is of three types. One is a community-acquired pneumonia. The second pneumonia which happens, the community-acquired pneumonia is basically a pneumonia which happens from the community, because you come from the community, and the commonest pneumonia is a streptococcus pneumonia, which you had. The second pneumonia which happens is a nosocomial pneumonia, which people in the hospital, they get it because of the nurses, because of the environment. And the third pneumonia is called the immune-compromised pneumonia, that happens in a very immune-compromised patient, those who are suffering from malignancy or diabetes or some low immune status. So you neither you are immune compromised nor you're nosocomial, it's a community. So in community also, the take home message is that in community also we have difficult pneumonias. They can be life threatening, they can drop your oxygenations. So we have to take care of those, because the first law of nature is a self-preservation. You have to take care of your own system. So you must eat well, you should take your breakfast in time, you should not miss your inhalers, you should do regular gargle and steaming, you should do regular hand washing, and also you should make your environment as clean as possible. Thank you, Mr. Ajay, for recovering, and thank you for giving us an opportunity to treat you. And we want that the message, as an educated person, your recovery should go to the people at large, and we post it so that more and more people can get.
I must thank the supporting system of the hospital also. They are very, very nice, very polite, and very good service they have.
So you want to speak good thing about the National Heart Institute? Do you think
yes,
that the hospital is very clean, which is very good?
Yes, I am more than satisfied with the service they have rendered to me.
And as a family, is your daughter? You have a very pretty, lovely daughter, and she is also an asthmatic. I treat her for so many years. You want to speak something on behalf of your father or the hospital, the support system, about your doctor, whatever, you want to say something, your father?
Yeah, the support system has been meticulous. I mean, it's almost like we didn't expect. Everything is on time and such great care is being taken. A lot of things I have also learned, like being an asthmatic myself, some things that you've pointed out, like, getting our mattresses changed, keeping them clean, keeping the surroundings as clean as possible, and also, like you said, like the symptoms we see, like, cough and cold, but because they're so common, we tend to ignore or delay or not take proper medication. But I think now we're very, doubly careful about these things, and all mattresses have been changed. We are doubly careful about the cleanliness, and about any even slight symptoms are taken care with maybe steaming and proper gargling and, sanitation.
Do you think the protocol which we are following, you see that, I'm as a senior pulmonologist here, I've set a lot of guidelines here. You see that little things I take care of here, the cleanliness, the night round, so that those things, do you think the model which we are practicing as a super specialty tertiary hospital here, which is different from the other hospital which you have experienced?
I think it is. Firstly, I think it is very disciplined. It is very important. It's difficult to maintain in India. Probably we ourselves also face, there are some cons that come with discipline. But I think that is really important. As family also, we've got attuned to this discipline, and the structure that is followed, everything is monitored. So even as laymen, we are understanding what is happening, and the kind of support system, for example, physiotherapy that is being done, some alternative exercises, etc., that are being done. I don't think a lot of hospitals or
so you give credit to the whole support system, the whole
entire
team,
system,
entire system, and you think. And what is the take home? You think the people are very empathetic? They take on the call? Are they take you as a patient, or they make you human? The support is good. The feeling is there.
Yes, of course, it is.
The feel factor.
There is this feel, the empathy.
Empathy factor.
Yes,
because you don't need sympathy. You need empathy. You have to feel, with the patient. That is the more important, because which is lacking, and we are trying to create a difference in the society by little structure protocol. And I think in every disease, whether in the lifestyle or in your disease or in any other areas, if you follow the certain system and you follow the protocols, I think a lot of things can be done.
Exactly.
And thank you so much for being with us, and thank you so much for taking National Heart Institute as a hospital.
Thank you also for giving us proper care.
Thank you.
I would also like to thank our doctor. I mean, you've created an entire ecosystem, which even once he's discharged, I think all of us are going to take it up with us. So thank you so much for creating this ecosystem.
I think we should thank the whole family, the whole hospital, the management, including our whole team, our Saans Foundation, our CEO, Mr. Ghosh, and everybody who is taking a little effort to reach out to the community and create a difference. Thank you, sir. Thank you.
Thank you.